Thank you, Supervisor Cox. Before we get to the numbers, I want to walk through in a little more detail the governor's announcement today. We know that this is a very challenging time where you have information from a lot of different sources that are all coming to you at one time, and you have a lot of overlapping jurisdictions, and it is a situation that lends itself to confusion. And so I want to try and provide just a little bit of clarity and a little bit of framework for where we are in San Diego County today in terms of what we can do from the state of California and what we cannot do as a region. As was mentioned, effective tomorrow, retail entities like bookstores, jewelry stores, clothing stores, shoe stores, home and furnishing stores, sporting goods stores, antique stores, music stores, and florists, those entities are allowed to open tomorrow for delivery and curbside pickup only. It is also allowable for manufacturing facilities, warehouse facilities, and logistics facilities that support these retail entities. They may also open effective tomorrow. Each of these businesses that open needs to go to the county website and download our Safe Reopening Plan, complete that plan, and post it along with providing that plan to your employees. Now, in addition to the plan that you need to post, attached to the bottom of that plan is a checklist that came from the state of California and for the governor. This checklist will guide you and assist you in filling out your Safe Reopening Plan. You do not need to post this plan. You only need to post the Safe Reopening Plan. So again, if you are a retail business that is in the category that I just outlined, and you can do delivery or curbside pickup, or you are a manufacturing, warehouse, or logistics company that supports those retail entities, you are free to open effective tomorrow, contingent upon completing our county Safe Reopening Plan. At the bottom of the Safe Reopening Plan, you will see a checklist from the governor you can use as a guide to help you complete it. But we're trying to make this as simple as possible. We don't want you to have to go to two places and download two different things. So the only thing that you need to complete is the county's Safe Reopening Plan. You will see at the bottom of that a general checklist from the state of California that you should use as a guide. But again, fill out the Safe Reopening Plan, post it, send it to your employees, and you are free to open in those entities as soon as you do that, as soon as tomorrow morning. Now, the state also outlined that there are additional companies and additional entities that are in stage 2 that they believe that will be coming soon, but not tomorrow. Those are things like offices with physical distancing, seated dining at restaurants, shopping malls, outdoor museums. Those are, they said, coming soon, but not here effective tomorrow. So effective tomorrow is just those retail entities I outlined, manufacturing, logistics, warehouse. Download our Safe Reopening Plan, fill it out, you can open. There will be additional companies, entities that will be available per additional state guidance. Now, there is a mechanism in the state plan where counties can move swifter than this if they meet certain criteria. Unfortunately, San Diego County does not and will not in the foreseeable future meet that criteria to move faster than the state of California is allowing. And so at this point in San Diego County, we're going to move consistent with the governor's guidance. So we hope that that provides a framework and some direction about what we need to do, what we can do, what we can't do, and where we are. We should expect regular updates from the state of California, and as we get those updates, we'll digest what it means for us here in San Diego County. We will share that with you, and then we will all move forward through this difficult and challenging time together. As it relates to childcare, which is a vitally important part of any ability to reopen our society, you cannot effectively reopen jobs if schools are closed and there's no places for kids to go during the day. We have been working with a number of childcare providers in terms of looking at how it is we can get more of them up and running and online and available to be in a position to reopen. We are making some modest adjustments to our child care provisions in our public health order. We are simply going, right now the limit was 10 kids, we're going to 12. We simply want to align and be consistent with the state of California. We are clarifying that in child care facilities, the mask requirement does not apply in that controlled child care setting. It is simply not feasible or practical. And we have amended our hygiene standards to make clear that things like bathrooms or contact surfaces can be utilized by multiple groups of 12, provided that there's regular cleaning in between those, and you will see those in our public health orders. Again, they're generally modest changes to our child care order, but they are designed to make it a little bit easier to open and comply. We've been working with a number of child care providers, in particular the YMCA of San Diego County, which I know has an interest in figuring out how they can get their summer child care programs up and running to be a resource to parents as we begin to go back to work, and our efforts will continue. I've been in conversations with our schools and superintendents about what they're imagining when they get the go-ahead from the state of California. We'll be talking to them more next week. Been in conversations with a variety of child care providers about what they need in order to be able to get up and running. Those conversations will certainly continue next week, but we are aware that in order to open our economy, we have to simultaneously work with those child care providers to make sure that safe environments for kids that are adhering to what we think are the best practices that are available, understanding the constraints of child care settings are in place and that they are allowed to open and move forward. And so our efforts to try and provide more child care opportunities, get those open and online, will continue, and we believe that we will see progress this week, over the weekend, and into next week in order to make more of those available. Now we'll jump into our update today. Significant jump in testing today. We had a number of entities that did not report over the last few days, but today we're reporting 3,325 tests that were done. We're reporting those today. Brings us to 69,062 total. A few more contact tracers, 163. To be clear, we have an initial goal of 450. That is an initial goal. That is an organizing goal that we are using. We are in the onboarding, backgrounding, training, hiring process as we speak, and we expect to see the 163 number continue to increase. We also expect that the number we have as a goal could change and go up in the future as we continue to get additional guidance and input. 5,396 investigations performed to date. We presently have 188 individuals utilizing our public health motel rooms. This is the third T of the test, trace, and treat for 588 cumulative individuals involved in that. Today we're reporting 110 new positive case results for COVID-19. Again, this is out of a substantially large number of tests today, 3,325. And again, today's testing, the asterisk there reflects we got some batches of tests that were not shared the last few days. They all came in one day, but that has us at a very low 3% of total tests came back positive. Drops our average there quite a bit. In terms of hospital capacity, we're presently at 134 COVID-related patients in our area ICUs. Total hospitalizations for COVID, both ICU and non-ICU, presently stands at 379. And then you will see that 379 that are hospitalized here on the next chart in the context of the total hospital bed utilization at 3,840. Again, the orange representing the COVID, the turquoise color there representing non-COVID, and then you see an additional uptick in current bed capacity with more hospitals reporting their available beds. Last one here is just our cumulative totals. You see the total number of positives for our region to date, 4,429. Estimated recovery there at almost 2,500. Hospitalizations cumulative, the doubling rate of 31 days. ICUs cumulative, along with the doubling rate of ICUs at every 37 days. And so again, we will continue to provide guidance on what entities are open, but just to reiterate and recap, those retail entities that can do curbside and delivery, consistent with the categories we outlined, along with warehouse, manufacturing, and logistics associated with those entities, are free and clear to open tomorrow, provided you have completed the county's safe reopening plan, which is located on our website. At the bottom of our plan is a checklist from the state of California that can help guide you through things that you need to think about, but completing the county plan and posting that is the only thing you need to do. We will await further guidance from the state about other entities and sectors that can open. They said coming soon, but not immediately. And then the last piece, again, to reiterate, because this is the part that will cause confusion, there is a provision that allows counties, if they meet certain metrics, to go beyond what is allowable right now. But those include essentially 0 deaths in the last 2 weeks from COVID and a number of other things that no large urban counties in California will be able to meet. That does not stop us from moving forward with the retail. That does not stop us from moving forward with the warehouse and the logistics. It just stops us from moving beyond what the state of California has outlined. So we know there will be questions. Again, as Supervisor Cox outlined, there is an email on the county site for questions about business reopening. We want to try and provide as much information as clearly as possible with what we know at the time, and we will continue to strive to answer questions and provide that information.